So yes, that is calculus falling off of my patient's tooth as we are doing their deep cleaning. So let's talk about it. What are the top common signs of gum disease, also known as periodontal disease? First one is red, swollen, or tender gums. Now you're going to see some inflammation as one of the earliest signs of gum disease, especially in gingivitis, which is inflammation of the gingival tissues. 2. Bleeding gums. Now, gums that bleed easily during brushing, flossing, or even eating are a key early indicator of something happening. So definitely check and see your dentist as soon as possible. Third one is persistent bad breath. Now, no matter what you're doing, brushing, flossing, rinsing out, and you're still getting consistently bad breath, that's caused by bacteria in the plaque and tartar buildup under the gum lines. Not above, but it's actually underneath the gum tissue. Things that you can't see at all. The fourth one is receding gums. Now, if you're seeing your gums are pulling away from the teeth, making the teeth appear longer than usual, that's another sign of gum disease happening. The fifth one is loose or shifting of the teeth. Now, this is a sign that the disease may be damaging the bone supporting the teeth. Now, you kind of have to understand the analogy that your tooth is like the tree, the gum is like the grass, and the bone is actually like the dirt. Now, if the dirt is receding, that means your tooth is going to look longer, and that's what's going to loosen up the teeth over time. Number 6, pain while chewing. Now, if you're experiencing that while chewing, there is a sign of an infection internally, and that could be an advanced gum disease that has been occurring. Now, you have to understand that you don't have to necessarily feel anything while this is happening. This could be occurring slowly over time until one day it hurts so much that now you're forced to see the dentist as soon as possible. Number 7, you're seeing pus between the teeth and gums. Now, this is a definite indication of an infection and a sign of advanced gum disease. Now, if you're experiencing this, definitely stop and call and schedule an appointment with your dentist, because this is an internal issue and should be, of course, handled with some antibiotics and, of course, be seen by the hygienist or dentist. Number 8, changes in the way your teeth fit together when you bite. Now, of course, this is one of the signs. It's not always fitting that this is the actual sign of gum disease, but it's a possibility that I've seen because it's now causing your teeth to shift due to the bone loss that's been occurring slowly but surely. Number 9, sensitive teeth. Now, this is usually coming from the receding gums that's exposing the tooth root, and that can actually now expose a lot more of the nerve endings of the teeth, and hence it's more sensitive to hot and cold drinks, food as well. And number 10 is your gum pockets. You're actually going to start to see deep spaces between the teeth and the gums because that's where the bacteria likes to accumulate. You're going to start to see natural gaps that's occurring, and you're noticing food getting stuck easily, like especially like popcorn kernels, chili flakes, seeds, things like that. So these are the most top 10 common signs of gum disease that you definitely want to get checked out. Now, there's a lots of other tail signs of gum disease, but like I said, not everybody's going to fit in these all 10 signs of gum disease. You could just be experiencing a couple of those, but if you are, you definitely want to get that checked out as soon as possible. Why wait? And I understand there are times when we feel, yes, dentistry is very expensive, but it does get costlier as we don't confront the situation and we wait and wait. And it actually costs more to replace a missing tooth versus trying to fix something that could technically be fixed more holistically, such as a deep cleaning. Now, in the situation of a gum disease, that's usually the most common treatment is getting a deep cleaning where the hygienist or the dentist is going to numb your gums up and to be able to treat and clean out underneath the gum tissue using a Cavitron, an ultrasonic scaler, then also hand scaling, which is very important in the process. And they're also going to polish, floss, use some antibiotics, irrigation, and even sometimes gum laser treatment as well, depending on the severity of the case. It is case by case, such as this patient. And usually this can be done in one visit or two visit, or it can take up to 3 hours, which it did for this patient. So if you are experiencing this, please call your dentist, get seen right away. And of course, you're always welcome to see us here at Rosie Dental. I love taking care of my patients. This has all been done by me, and I'm so glad that I was able to take care of her and get her handled because she did find me on TikTok. So love TikTok. See you soon.